is Dr. Liv with New Insight, and thank you for joining me in another video. Today, I'm discussing borderline personality disorder, often called BPD, a condition that deeply affects how a person thinks, feels, behaves, and connects in relationships. If you or someone you love struggles with intense emotions, fear of abandonment, or unstable relationships, this conversation matters. My goal is to help you understand BPD from a therapeutic perspective, and more importantly, to highlight the skills that support healing and healthy connection. So what is borderline personality disorder, or BPD? BPD is a cluster B personality disorder characterized by the following behaviors: mood instability, impulsivity, intense fear of abandonment, unstable interpersonal relationships, poor or fluctuating self-image, self-harm or suicidal behaviors, anger and irritability, difficulty regulating emotions, and dissociative behaviors. These symptoms can cause significant impairment in how a person thinks, feels, and functions day to day, especially in their interpersonal relationships. BPD impacts how someone copes with stress, manages emotions, and experiences closeness with others. Treatment can include therapy and sometimes medication. However, because BPD is a personality disorder, there is no official medication that treats BPD itself, according to diagnostic guidelines from the American Psychiatric Association. However, medications may help manage associated symptoms such as anxiety or depression, but therapy, however, is the primary and essential treatment. In therapy, individuals often work through the following: abandonment and trauma wounds, attachment difficulties, self-esteem and identity struggles, trust issues, emotional regulation, adaptive coping skills, and overall stress management. One hallmark of BPD is difficulty establishing and maintaining healthy relationships. Because of this, many people experience anxiety and depression, loneliness, fear, and frustration. And with BPD, there can be conflicting emotions about interpersonal relationships, wanting closeness one moment, then pulling away the next. Someone may move from feeling eager and excited to suddenly suspicious or overwhelmed about their relationships. And this inner push-pull dynamic can feel exhausting. So let's talk about this from a therapy standpoint. Here are 5 essential skills that support self-regulation and healthy connections. These skills are essential for everyone to learn, not just individuals diagnosed with borderline personality disorder. And they include the following. Number 1, effective communication. This is important because you learn to truly listen or actively listen, speak assertively, be mindful of your tone and choice of words, compromise, and express needs without emotional explosions. This also includes keeping your emotional thermometer balanced, being proactive instead of reactive, and learning to manage stress without anger outbursts or emotional meltdowns. Number 2, conflict resolution and healthy decision making. This skill is about learning how to navigate disagreements without emotional escalation or impulsive reactions. Conflict is normal in relationships, but how you handle it makes all the difference. Healthy conflict resolution means the following: learning to pause before responding, taking responsibility for your part instead of blaming, expressing your needs without attacking, being open to compromise, and practicing accountability and relationship repair after misunderstandings. It also involves effective decision making, choosing wisdom over reckless or impulsive behaviors. And instead of acting on intense emotions in the moment, you learn to slow down, weigh the pros and cons, consider both short-term and long-term consequences of your actions, and ask yourself, is this reaction helping me or harming me? and this builds discernment. When impulsivity decreases, emotional safety increases for both you and others. You begin making choices that support stability rather than chaos, and connection rather than conflict. Number 3, emotional regulation. Emotional regulation is the ability to experience emotions without being overtaken by them. People with borderline personality disorder often feel emotions more intensely and for longer periods of time, which can lead to overwhelmment, emotional flooding, or shutdown. This skill teaches you how to identify emotions early before they escalate. Identify and name what you're feeling instead of acting it out. Create space between emotions and behaviors. Calm your nervous system and ground yourself during times of distress. Emotional regulation is learning how to feel without exploding or imploding. Emotional regulation helps you stay present during difficult conversations, tolerate disappointment, manage rejection sensitivity, and recover more quickly from emotional triggers. Instead of emotions driving your actions, you learn to lead your emotions. This creates inner stability, and inner stability is what makes healthy relationships possible. Number 4, distress tolerance and self-soothing. This is the ability to sit with uncomfortable thoughts, feelings, and situations, to ride the wave, to move with the ebb and flow of life without a mental or emotional breakdown. Distress tolerance builds psychological flexibility, helping you adapt to change and withstand life's trials and tribulations. And number 5, cognitive challenging and reframing. This is learning how to challenge unhealthy thoughts and rewrite negative inner narratives. Your thoughts can keep you trapped in hypervigilance, suspicion, taking things personally, jumping to conclusions, making negative assumptions, and magnifying the bad while minimizing the good. These thinking errors and others can distort reality and damage your relationships. Healing involves learning to recognize these thought traps, reframe situations, and stop letting unhelpful beliefs lie to you about yourself and others. The truth is, healthy relationships require you to be healthy first. Your core must be healed because this is your foundation, the base from which everything else is built. When you learn emotional regulation, effective communication, distress tolerance, and cognitive flexibility, you don't just improve relationships, you transform your entire life experience. So if you're struggling with BPD traits or relational challenges, please know this: healing is possible. With the right supports, skills, and commitment to growth, you can build stability, self-trust, and meaningful connections. Thanks for watching, and I'll see you in another video.